Thank you so much, Sheriff Diggins, and thanks also for our recent meeting. I really enjoyed it. First question I have is why the county jail expenditures are increasing. My understanding is that the jail population in the county jail specifically has dropped quite a bit to below pre-pandemic levels. So pre-pandemic, it was typically around 1,800. In 2017, it was around 2,200. Now we're around 1,700. So it's a big drop in the county jail. Why is there a budget increase and an FTE increase for that jail, if I'm reading it correctly?
Well, thank you for the question. Actually, that count is for both facilities. So it's across the board. The county jail's rated capacity is about 850 beds, and the downtown detention center is 1,500 beds. So that's where we get the 2,350 rated capacity for our entire jail system. And so, I'm sorry, where are the increases that you're specifically talking about?
I'm seeing county jail expenditures up 6.6 million and 61 FTE. That we just saw on the slide. Okay.
Yeah.
And so
I was off. I'm so sorry. Did you hear me?
I could hear you.
Okay. Sorry about that.
But for those listening, the budget director here says that 4 million of that increase is the increase in food costs that we just saw. So that leads me to ask why that increase in food costs about 50% over the prior year.
The previous contractor that was on board brought in enough staff to do the food service program based on some of their staff doing the food work and some of our staff doing the food work. Over time, we have staff that have retired, that have left the department, and additionally, they are providing greater product for the folks that are in our custody. So with that, along with food increases across the nation, what jails across the nation have seen is that food costs have gone up the same way that they've gone up for you and I purchasing food for our families.
Okay. Thank you. And then my second question is, my understanding is that for uniform positions across the department, you've got about 550 of them filled and we're still budgeting at full strength. Is that correct?
That is correct.
You just told us that it takes about 3 months to onboard someone. So I'm curious why we would not budget for a more realistic staffing level rather than, expecting that we can actually fill that entire gap and budget for that.
A good question, ma'am. We use those dollars to backfill staff and to also pay for the overtime that it costs to fill those positions. Every single post has to be filled by someone. And so we take those dollars and pay the deputies that are working extremely high numbers of overtime with those dollars. So we call that vacancy savings.
Okay, and is that essentially flat? Like, are you spending as much on overtime as you would on being at full strength?
I'm sorry, I couldn't hear you, ma'am.
Sorry about that. Is the amount that you're spending on overtime equivalent to how much you would spend on being at full strength?
I would ask Stephanie to answer that question. This is what I would say, Councilwoman. In using those vacancy savings, we, in years past, have hit the mark for the gap for vacancy savings, but as our number of staff have decreased over the years, we have spent more in our overtime dollars than we have for vacancies.
Okay. Thank you. And I think I took some liberties with the 2-question limit. So apologies, Madam Chairwoman, for that.
Go ahead. All good.
Thank you so much. Ping-ponging back all the way to the other end here. So is there money in this budget that's sort of earmarked to be used to convert pods of the jail to treatment facilities in some way? It's a plan I've heard floating around. And I'm just curious if that is budgeted for or planned for in some way, to get a little more detail about who would be in these pods, how they would get there, whether they're diversionary, whether they're run by the Sheriff's Department, all of those kind of details, because I think it's important as we look at this budget, if that's something that's planned to come on deck in 2024, to know about that.
I will ask the mayor for a little bit of assistance in answering this question. We have had preliminary conversations relative to what we're going to do in 2024 to meet the mayor's goal and his vision of expanding the services that we're offering.
Sorry, Councilman Parady, it's a little hard to hear you over here, which either could be audio or just that I'm old. But I think your question was about the expansion of services at the jail around mental health and addiction treatment. Was that your question?
How I've heard it expressed, and it's your idea, I think, but what I've heard is the idea of using pods at the jail as some kind of health care or treatment facilities. So that's what I'm curious about, and in particular, if it's in the budget.
Thank you. So it's something we're working on and looking at. We know that we have a significant number of people that are currently in the jail that have mental health and addiction-based needs that want to get access to those services. We also know we'll have folks that are currently really struggling with addiction. We've had a number of, I think, 3 or 4 more overdoses just in the last 3 days alone in the streets of the city. And so we know this is an existing crisis. And so we're looking at ways to do both outpatient treatment as well as services to folks that are in custody. And so that's in the preliminary stages. But as we get closer, we would determine what the budget needs would be. As you may know from yesterday's conversation, currently a lot of those services that are provided in the county jail are provided right now by Denver Health. And so you'll see actually even in the sheriff's budget, I think there's a $2.5 million increase for the Denver Health staff that are working in that facility. And so that could be any number of either nonprofit partners or mental health partners, both inside or outside in terms of service provision.
Okay, but here's my question about that. What population are we talking about? That is this is the idea here that this would be folks who are sentenced to the jail or they're in pretrial detention and they're receiving treatment, but they would be there anyway? Or are we talking about people essentially going to the jail just to receive health care?
Sorry. No, this is about people that are sentenced to jail otherwise. People that are sentenced to jail facing treatment, facing sentences, but we know the primary need driving the criminal acts that they're getting them sentenced are related to addiction or mental health needs. And so this is a matter of folks facing sentences for existing crimes that we think would be better served by having access to treatment while they're in jail than not.
And would it replace any kind of diversionary programs that have allowed people to basically be free on some kind of release?
Sorry, you're asking, are they able to be free on release while they're there?
No, I'm asking whether this would lead to people remaining in the jail under a sentence who would right now be under some form of release.
So the folks that are currently there, I'm sorry, the audio is super bad, but you're saying would the current people there be eligible for release? Was that your question?
No, I think what I'm trying to get at is it expected that this would drive up the population of the jail? In other words, that coming with treatment provision, there might be more people then who would be sentenced to the jail with treatment who currently might now be released or diverted into some other kind of program.
Oh, gotcha. Yeah, I think that I would have to talk to the sheriff about what the current sentences are in terms of length of stays, of who's there, what the release structures are. I do know we talked about ComCore earlier. We have a significant opportunity to get people out of jail earlier into community placement. That is part of the goal. We want to have more options for people to get community-based placement. There's also, obviously, the priority is always to get everyone served outside of custody that can be served there. So like any intervention, anyone that comes through the criminal justice system, our first priority is to get outpatient treatment and support without them needing to go in custody. This is simply looking at the significant numbers of folks that will be coming into sentences for other charges for whom their primary needs are mental health and addiction treatment, and how we can provide better resources to them while they're in custody. Great.
I hear what you're saying, and I think there's a big difference between a program that I'm really pleased that we've had declines in the jail population over the years. I think that's something that is viewed as a good outcome and has taken some work to achieve. And I wouldn't want to see us backslide on that kind of under the guise of treatment. So thank you for answering the questions.
And the only thing I'd add to that also, which the sheriff has made clear to me, is I think one of the key places we are failing is on the transition support for folks who are coming out of jail into the community, particularly those who struggle with addiction or with mental health needs. If we don't have a really successful handoff to service providers outside when they come out, the risks are very high for folks that have addiction needs and that have mental health needs. And so I think a big part of this is both reducing that long-term prison population by reducing the recidivism rates that happen when folks enter or exit without those wraparound services. So a big part of this is prevention before they come and wraparound services after they transition. So we make sure people succeed after that placement.
Back to my question about the budget. Is it reflected there at all?
We do not have a line item for this because the program is not designed yet. We're beginning to work with the sheriff, with nonprofit partners, with mental health community and others about how we would do this and how to support it, but that's in the early stages.
Great. Thank you both so much.
Yeah.